You're listening to the official OSAP Podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello, and welcome back to OSAP's official podcast. I'm Michelle Lee, and I am so excited today to have as my guest an OSAP member, Olivia Wann. And Olivia is not just an OSAP member. Let's talk about Olivia. She is an attorney. She owns a consulting practice, Modern Practice Solutions. And if I recall, I hope I'm right about this. I should have verified this with you ahead of time, Olivia. Didn't you get started as a dental assistant?
That's correct. I was an office manager and an RDA for 14 years.
I love that. So, and tell us, how did you make that transition into law and to compliance?
Well, I was working for a general dentist and loved my job and had the opportunity to start training people how to use their practice management software. And so that basically launched my training career. And I decided to go back to school when I started speaking professionally. So I finished a degree in healthcare management and loved it. And I really enjoyed the ethics involved in healthcare and went on to law school.
Wow. Wow. And then the rest is history. And who knew when you made all those decisions that many years ago, you would be helping dental practices manage a pandemic?
Oh, how true. We would have never dreamed that this would happen, for sure.
Right. So I know you've been very busy the past few months. So I always like our listeners to know a little bit more about our guest. And I know that you have a farm in Tennessee.
Yes.
And which, of course, because of the joy of social media these days, I've seen pictures of this beautiful farm, and you have miniature horses.
I do. I have miniature horses and goats and quarter horse and walking horse and dogs.
Oh my gosh.
So yes, that's my passion. I love the farm and I love to be outside. And luckily, this profession has enabled me to live in a rural community like I do, but yet reach people all over our country.
Right. And I'm sure that's what you've been doing a lot of the past 9 months is training right there from the farm,
Yes.
right? Remotely. So you
Yes.
get to enjoy it a little bit more.
How true.
So I know you were on the road as much as I was, right? So that, we have to, I keep reminding people we have to stop and just be thankful for little moments. That certain things that the good that have come out of the pandemic. So I'm very thankful for that as well. Just more time with family and finding new ways to get our message about safe dentistry across.
I agree. And we've learned that we can train people remotely, virtually, and be very effective.
Mm-hmm. So I asked Olivia to join us today because we're getting a lot of questions in regards to employment law and COVID-19. And I thought, wow, this is the perfect person to have this conversation with because she's all about compliance. She's all about law and she's all about dentistry. So why don't we just start with, telling me what are some of the questions that you're being hit with from some of your clients and how are you helping them walk through these situations?
Well, I would love to elaborate on it a little bit for you because we are getting a lot of support questions relative to so many dental professionals that are having to be quarantined. So whether they are being quarantined or they've tested positive with COVID or they're sick with COVID, we're getting questions from dentists on whether or not they're supposed to pay employees for this. So I thought this would be a good review. Now, granted, this information is current through December 31st, and we are awaiting guidance for year 2021.
Mm-hmm.
Now, can I share my screen so we can follow along together?
Sure. Our listeners won't be able to, our podcast listeners won't be able to see it, but you who are viewing us on YouTube absolutely can. And this is, I will like to share that this is our first podcast that we're also recording for our YouTube channel, specifically for these types of reasons, so that when we have guests that have some slides, some information, you may be listening to this on your podcast, but you'll be able to go back when you have time, and download this information from our YouTube channel.
That's awesome.
Perfect.
Thank you, Michelle. So the exposure, if a healthcare personnel worker had prolonged close contact with a patient, visitor, or someone with confirmed COVID-19, we look at what kinds of personal protective equipment were they using. And I guess I should back up because we have to define what does that mean, prolonged contact. And
Mm,
according to CDC, that means we were in the presence of someone within 6 feet, 15 minutes or more. And 15 minutes has been further defined as being cumulative,
yes.
not consecutive. So if we were around someone for 5 minutes 3 times, then we see that we have triggered that 15-minute limit there. So if we were evaluating PPE and the healthcare worker was not wearing a respirator or face mask, not wearing eyewear protection, if they were doing an aerosol generating procedure and they were not wearing all of the recommended PPE, including a respirator, then it would trigger being excluded from work 14 days after the last exposure. And so that's where we get the questions, is that, okay, someone's been exposed and they're under quarantine, and what are the compensation requirements? I do want to mention, Michelle, that we just received an update yesterday that CDC now recommends 2 additional options for how long quarantine should last. And we should always compare this to our local health department to see if there's any variance.
Yes.
But it could be day 10 without testing, or day 7 after receiving a negative test result. So I do want to mention that because this is so new in being released. But a good place for listeners to start is to download the Employee Rights Paid Sick Leave and Expanded Family and Medical Leave under the Families First Corona Response Act. So when I get questions, support calls, or messages, this is usually where I start, is I send them the link so that they could read through the paid leave entitlements and whether you are eligible and have qualifying reasons.
Mm.
So what questions can I take from you, Michelle?
Well, so is this state by state, or is it um, do, does this guidance cover all of the entire country?
Yeah, so this is federal.
Okay.
Some states might handle it a little bit more differently, but we're going by the federal guidance. And a question that we get is, how much paid leave can employees take? So
Mm,
if you're under quarantine, we look at the poster with those requirements, and it would qualify someone up to 80 hours of paid leave. So that's if they're following federal, state, or local quarantine or stay-at-home order, or they're quarantined by their healthcare provider. Or another case would be if you are experiencing COVID-19 symptoms and you're seeking a diagnosis and you're
okay.
not able to work from home. So that would trigger what we call COVID pay, which is up to 2 weeks.
And how much? How much are people paid? And
That's a great question because everyone's curious, would it be the same? And it is. It's your regular rate of pay. Now, if you are a higher paid employee, the maximum payable is $511 per day. Now,
okay.
a lot of dental offices only work 4 days a week. And so your rate of pay would be adjusted to your average hours worked. So if you only work routinely 32 hours a week or 36 hours a week, it would be prorated to that. So it's not like you have an 80-hour bank to pull from.
So I imagine when an employee takes leave, you're going to have a lot of records that you have to keep.
That's correct. And so we are trying to encourage dentists and office managers to revise their documents, because we would need to maintain the name of the employee, the dates for the leave that's being requested, the reasons for that leave, so it's indicated coronavirus, and a statement from the employee that that person is unable to work. And also, if they're being quarantined, document the name of the healthcare provider. So in my practice, we've had to deal with quarantine as well. And we
Mm.
simply just took a PTO request, a standard HR form, and I had the employee mark through PTO and write in COVID-19. And
Mm.
this way, the compensation could be tracked differently than standard wages.
I understood. And if a person can work remotely, then they're not paid normal. I mean, they're not paid anything in additional. They have to work, right?
Correct. So in the cases of my practice, I had an employee that was exposed and she had to be under quarantine. She was not sick and she was
Mhm.
able to work from home. So basically, she was not receiving COVID pay. She was receiving her regular wages, but she was working remotely with a notebook computer, which worked out beautifully. So I'm really encouraging dentists that if you are running into this situation, then don't be so reluctant about the compensation, because this is an opportunity. Just yesterday, I spoke with a dentist. Maybe the employee could fulfill CE requirements. They could go through their safety data sheets, make sure it's up to date, their OSHA, HIPAA forms, policies. There's lots of things that they can do remotely and still be productive in the services they're providing at your practice. And so,
And it's probably things that people just never get around to doing, right?
yes,
That they need to be doing. Yes.
exactly. And there's never enough time in the day. So this could be a time to do catch up work.
Okay. All right. And then you have those situations where people, they may not have been diagnosed, but they think they may have symptoms, correct?
Well, and it's not as simple as saying, I don't feel well, I'm not coming into the office. In
Mhm.
order to qualify for this type of leave, we would have to identify the symptoms we're experiencing and a date for a test or a doctor's appointment. And so, we want to be honest and have integrity why you're taking this leave. Now, on the other hand, the employer, the dentist or office manager cannot, and I get this question, they cannot require the employee to provide further documentation or some kind of certification that they sought a diagnosis or treatment from a healthcare professional. And the reason is that we're trying to promote people not spreading COVID-19 by making these policies so rigid and difficult to satisfy.
Ah, understood. But if they've been exposed, do they have to show a test, a negative test to return to work?
Not necessarily. And so they could share this information, but they cannot be required to certify.
Okay. And okay, got it. All right. What other paid leave is available?
If you have to care for someone that is being quarantined, or you're taking care of your child because the school is closed or daycare provider, then that would trigger some other paid leave, which should be up to 2 weeks, which is up to the 80 hours, depending on your work week. But it's paid a little differently, Michelle, because it would only be 2/3 of your regular rate of pay and a maximum cap of $200 per day.
So I don't think I knew about this. So can this be in addition to that 14-day leave if you're sick?
It could qualify them for that paid leave,
So
because it's actually up
it's
to 12
additional.
weeks available.
Okay.
This comes under the expanded family and medical leave. You may take the paid sick leave for the first 2 weeks for someone else,
Mhm.
and the following 10 weeks, you could qualify for 2/3 of your regular rate of pay, entitled to a maximum of $200, which for the whole 12-week period would be $12,000. Now, we have found this to be unusual.
Mm.
employers are taking an exception for this type of leave, which we'll get into in just a moment. There's actually two types of exemptions that employers can qualify for.
So, and I'm guessing this has to do with the size of the business.
Yes. So if you're a small business, the question is raised, can I be exempt for paying this expanded family leave? And so there's two exemptions that are available, and I wanted to go over that and explain it the best I can. That one exemption would be the small business exemption. You have less than 50 people. And the other is if you're a healthcare provider exemption. Now they work differently. So I'd like to elaborate on that
Oh,
and address some
please.
questions.
Yes, please. So does this mean that those employees would not be paid then?
Well, with the exemptions, for example, when does the small business exemption apply to exclude small businesses from the Emergency Paid Sick Leave and Emergency Family and Medical Leave Act? Well, first of all, if you have 50 or less employees, and if it's leave requested because the school is closed or daycare is closed, or providing that expanded leave would actually jeopardize the viability of that dental practice, because it's such a small business to pay out 10 and 12 weeks of leave for this expanded provision would actually cause that business to suffer. So if that person is asking for qualifying reason number 5 on that poster, and the dentist is choosing to take an exemption because they are a smaller business, really encourage them to document. So if you are audited by the Department of Labor, they may want to see that your operating account was not viable enough to pay out this type of leave. So it's all about the documentation that you could prove. And I would say that, this is an exemption to take advantage of because it's not geared to ruining businesses. We are trying to control the pandemic and how many people are being exposed. But then again, we have to be realistic about how your business could survive. Now, you can claim an exemption if you think about the provision. If providing that paid sick leave, this expanded family and medical leave, would result in your expenses not matching available revenue, and it would put your business at substantial risk of financial health, or there's not sufficient workers, then you could claim an exemption.
I would think a lot of dental practices would
Yes.
fall under this.
Yes, they do. And as we move through it, I will focus on what is more commonly paid out.
Okay. Um, so who who would um, um, who would be excluded um, from
Yeah.
the paid sick leave?
So we have another exemption. So that first one we've already talked about. The second exemption is if this person is a healthcare provider. And so they can
Okay.
actually be excluded by the employer from paid sick leave or expanded family and medical leave. And the Department of Labor divides healthcare providers basically into two groups. One would be licensed doctors, nurse practitioner, and other healthcare professionals that can actually issue certification for purposes of FMLA. But we also have group 2, and that would be healthcare professionals that are in diagnostic services, preventive services, treatment services, and those who assist in that care. So we feel like dentists can actually fit into group 2, but it does not include, and this was actually a case that came out of New York a couple months ago. So let's say healthcare providers can seek an exemption, but if that individual employee is not clinical, they're an IT professional or an HR person or an admin person working for a healthcare provider, they would not meet this definition of an exemption. So the employer could not seek an exemption.
So they would have to pay them.
Correct.
Okay. All right. And what happens if if an employer does not provide the paid leave and they're supposed to?
Well, and I will reserve that for another slide, but I
Okay.
would like to interject, Michelle, that in responding to these exemptions, keep in mind the whole purpose is to minimize the spread of the virus associated with COVID-19. We don't want people coming into work sick because they're going to lose their wages. That was the
Right.
whole intent, is that we want to keep people at home if they were exposed, if they were sick. So think about it. This is what the Department of Labor has pointed out to us, that an employer like the dentist or office manager, they may decide to exempt employees from leave for caring for a family member. Remember, it was available if you're
Mm-hmm.
taking care of someone else or your child, but choose to provide the paid sick leave in case of their own COVID-19 illness, because we
Right.
don't want people coming to work sick.
No,
And
no.
then as far as exemptions for child care related sick leave, fewer than 50 employers, if it jeopardizes your business,
Mm-hmm.
then you could claim the small business exemption. You don't have to send anything to the Department of Labor when seeking that exemption, but you need to make sure you have the documentation that would prove it, if you were audited, that you actually met it. Now, here's how I've handled it in my practice when I had someone that had symptoms of COVID and they were pursuing testing, and the healthcare provider provided me with an excuse, which means that until she received her results, she was under quarantine.
Mm-hmm.
And so she was paid. I paid for her paid sick leave. It was like 2 or 3 days till she had her results. And we are applying for the tax credit. So the Department of
Mm.
Labor and the Internal Revenue Service has made that clear, that eligible employers are entitled to receive a credit in the full amount of the required sick leave and family leave, plus any related health plan expenses and the employer's share of the Medicare tax
Okay.
on the leave. So I think to me, it was a win-win situation. I'm not out any money, because even though I paid it out, I'm going to get a credit for the tax. So it made sense to
Right.
me.
Okay. That makes more sense now. Okay. That helps. That will help our small dental practices.
Yes.
Yes.
So even though they may claim an exemption because they're not going to pay the 10 extra weeks of
Mm-hmm.
leave, if they have to pay for quarantine or someone's sick, then they can get the tax credit. So I encourage you, talk to your CPA who handles your payroll or assists you with your taxes, to make sure that you get your credit.
Oh, absolutely.
And then this gets back to your question, Michelle. What happens if the rules are not followed?
Mm-hmm.
And unfortunately, we get a lot of calls up to that nature as well. And first of all, the Department of Labor encourages employers and employees, talk about it, communicate, because sometimes it's a matter of the employer does not realize what these requirements are. And
Mm-hmm.
so you start out with the poster and you read through those requirements. And then if that's not providing resolution, you can always call the Department of Labor, 866-4 US wage. And
Okay.
unfortunately, it could result in a civil lawsuit. So I'm really hoping that dental professionals talk about it, communicate, and
Mm-hmm.
understand what the requirements are. And by the same token, understand what these exemptions are, because the viability of a business could be jeopardized if they're paying out these wages and they simply cannot afford to do so. So I think this is a great topic, Michelle.
Oh, it is. And thank you so much for taking the time to share this information with us. And we will be certain on the podcast to share these links to these documents in our show notes, so people can go back and able to download that. And as we also said, if you're listening to the podcast, jump over to our YouTube channel, where you'll be able to actually see Olivia and her slides as she shares this very, very valuable information. And for now, I just would again like to say thank you, Olivia. I hope I get to see you in 21 at some point
Yes.
at one of our mini dental meetings. Hopefully, we'll be back live eventually. And for all of the listeners, please consider joining us at our annual dental infection control boot camp. That will be January 25th through the 28th, virtual. And if you register and you're not available to log in during those hours, you're going to have access to the entire curriculum for 60 days. So you'll be able to join in because you're not going to want to miss any of these updates, especially this year with all the new interim guidance. So for until you join us again, thank you and stay safe out there. Bye now.